At Community Measurement, we've been doing quality measures with physician offices for about the last 6 years. And it was really fun this past year. I got a call from Dr. Chris Tashian here in Ellsworth, Wisconsin. He said they were going to make some changes to their small practice here in Wisconsin that they thought would really improve the results for the patients in their community. And I was a little skeptical, given that we have 400 and some groups that we're doing measures on, that they would have significantly improved results. And people often ask me, what really makes a difference in a practice? Is it to get the very best results? Is it having an electronic system? Is it having a big practice where you can send people for training? And what was fun was finding out then a few months later, Chris called and said they thought they'd done it. They thought they were going to be #1 for our vascular care measure. And sure enough, out of the 400 and some clinics that we report on, they turned out to be #1. And this is just a very interesting story of what they've done with just the resources that they have to engage their staff, to engage their patients, to get significantly better results.
We knew that healthcare is changing. We knew that there were things we could change and things that were beyond us. And one thing that we could change was the care we deliver in our clinic. That was 100% within our control. We couldn't control some of the other costs, but we could control the care. So we set out to say, how do we provide the best care, measure it, and give our patients what we think they deserve, the absolute best. I think it's important to understand when it was a physician-owned problem, we did well, but we plateaued and we really couldn't move to the next level. When we brought in our staff and we made them part of the equation, we really excelled and actually moved beyond the next level and really did well. I want to make it clear, our staff deserves the credit.
Well, I think initially I started to do some simple chart reviews on patients with chronic diseases and looking at their data, making sure that their patients were taking the right medications, making sure their labs were up to date and were in acceptable ranges, well controlled, whether that was their cholesterol or their diabetes, et cetera, their blood pressures. And then that was part of a process that the clinic developed to have the staff take a look at the charts before the patient would arrive, either the day before if possible, if it wasn't a same-day appointment. Take a look at the services that they would need, not only for the chronic diseases of diabetes and coronary artery disease, but also to see if their cancer screening was up to date, if their immunizations were up to date, so that some of that work that could be done beforehand would be done when the patient came, so that they could have everything taken care of at one visit while they were here. We also involve the front office so that at the time the patient calls and makes an appointment, that enough time is allowed for an appointment to deal with other issues that may arise rather than just a sore throat or an earache that they may have addressed as a need for the visit.
And this is the form we use, and we get their height and weight each time they come. We ask them if they've had their general questions, like if they've had their mammogram, their tetanus shot, their pneumonia shot, which is very important for heart disease and diabetes again. And we can follow through with that by looking on the sheet each time they come in. We go down this list, and the doctor also can see at a glance if they're up to date.
I always say that I'm a wonderful nag, getting patients in here when they need it, and just kind of a support person. Sometimes I'm just a counselor for people who are having diabetic fatigue. They're tired of having their chronic diseases, and they just need kind of a support person, kind of like a cheerleader, to call them and support them and encourage them. Now, when a patient is first put on their depression medication, the care coordinators follow up with them in about 6 weeks, usually 2 weeks after they're first started on the medication, to give a little encouragement. How are you doing? Are there any side effects? It takes time for it to work. We'll call you up in a couple of weeks. Follow up again in about 6 weeks, 6 weeks to 2 months. Following up again, how are you doing? You're due for your clinic visit. We do another, the PHQ-9. Sometimes we do that over the phone. But usually they come in to see their physician every 2 months, and then we follow up again at 6 months. Patients just need encouragement to know that that medication takes a long time to work, and to just encourage them to keep taking it. And kind of a go-between us and the physician, so if they have side effects, we can tell the physician right away, we can get things changed right away. Just expedite changing medications or increasing their medications if they need it, rather than waiting 6 months or 12 months before their medication is increased.
I am the coordinator of our diabetes education program for our whole set of clinics. And I come here 1 day a week, and I'll see anybody that needs to see a dietitian for whatever reason for medical nutrition therapy, but I would say probably 75% of what I do is diabetes.
We really push our patients to say, you know, at least once a year, you have to see this person, see what's new, let her spend an hour with you and your family, you know, whether it's your significant other or whoever, and spend the time that it needs so that you understand your illness and can manage it better.
And prior to that, the people from this area had to go to the River Falls Medical Clinic, you know, and some people, especially the elderly, just didn't want to do that, or it wasn't worth it to them. But when we're on site, you know, they're much more willing to come. This is their clinic, you know, and I think that increases the number of referrals that we see and the number of patients that come in for that education. And then we like to see them once a year for follow-up, which doesn't always happen, but we're trying to make it happen more often, because the studies show that people with diabetes do better when they see an educator on a yearly basis and come in and get coached and get remotivated and that sort of thing.
Another thing that we did was we instituted some standing orders for labs. There would be patients who'd come in for a test to measure the levels of a blood thinner. But our lab staff and our clinical staff were empowered to scan through their charts to look and see what other labs did they need and what can we get done on that day at the visit. And patients appreciate that very much, to try and make it consistent, make sure that we're being as efficient as possible. But it also helped make sure that we were keeping up with those routine labs that sometimes otherwise would have gotten missed.
Chris used to do AccuChecks 5 days a week, and now they went to 3 days a week, and just recently we're just doing 1 day a week on Mondays. Yeah. So her blood sugars are that great. And what else? You had her meds. She was on glipizide, and she was on a 10 milligram dose, and we've been able to cut it in half to 5, and they don't go much lower. So we're doing great with that. Her weight, you lost a lot of weight, right?
Yeah.
People don't know you downtown, do they?
No.
Chris knows, right, Chris? When you go out, what are the good food choices?
Salad.
Salad. Instead of a piece of cake, what could you have?
An apple.
Instead of 5 Cokes, what could you drink?
Water.
What else can you say about your health?
You feel good.
You feel good?
I think everybody takes pride in the end. There's nobody I know that goes to work at this building that says, I want to do an average job. They're all in there saying, these are my neighbors, these are the people kids go to school with, these are the people that I live with. We want to do the best we can. We want to provide the best care. And that's from the receptionist all the way down to the docs.
Yep.